Coming up on Network Africa, the World Health Organization raises its assessment risk of Ebola outbreak in the DRC from high to very high. Burundians await results of Thursday's referendum on extension of presidential term limit from 5 to 7 years. And the United Nations agency warns of impending crisis along the Niger border after allegations of Algeria dumping migrants in the Sahara Desert. Hello and welcome to the program. I'm Millicent Mwaka. The World Health Organization has raised its assessment of the risk to public health from the Ebola outbreak in the Democratic Republic of Congo from high to very high at the national level. 11 more people are confirmed to have contracted the disease and 25 people in total are now thought to have died. The WHO is to hold an emergency meeting today to consider the international risks of the outbreak. Meanwhile, Sierra Leone's military held a 2-day simulation exercise in Freetown to test the armed forces' preparedness in case of an Ebola outbreak. The medical unit of the Republic of Sierra Leone Armed Forces set up what they call a rapid deployable isolation and treatment facility at Wilberforce Barracks in the capital. Sierra Leone is holding emergency Ebola drills to test the preparedness for an outbreak. The country experienced the last outbreak in 2014 to 2016 that killed more than 11,000 people in West Africa.
In the context of an epidemic, some of the things that have been associated with transmission are the need to care for a sick person, and when a person is suspected to have Ebola, they need to be taken to an Ebola treatment unit so that they can be safely taken care of rather than being taken care of at home. Secondly, when there are fatalities during an Ebola epidemic, safe burial practices are essential. General hand washing of the population in the midst of an epidemic. In a situation like now, when there is no active Ebola, no special precautions need to be taken. And this field training exercise is not for anything going on at the present time, but in case there might be an epidemic sometime in the future.
We have been doing classroom work with our nurses and doctors, and this is like a simulation to see how we receive a patient. If a patient comes with Ebola, how we administer the drug and how we take care of the patient. So it's just like part of our normal routine training. It has nothing to do with DRC, but as we know, Ebola is an infectious disease and we must maintain our readiness.
Well, staying in the DRC, the United Nations Children's Agency says the conflict in the Kasai region has had a devastating impact on children, leaving some 2.3 million in desperate humanitarian need. The agency says there have been grave violations against children as they were made to fight, kill, and young girls were raped, forced into child marriages. Fighting between the army and local militias went on for about a year in the generally peaceful region's worst outbreak of violence in decades. As many as 5,000 people were killed and an estimated 1.5 million forced from their homes. While the fighting is said to have stopped, hunger and disease has become the region's most prolific killers.
We have children in transitional orientation center. We're giving them psychosocial support, life-saving skills. We also keeping them safe in that environment to help their reintegration into their families and communities.
In Burundi, the results of Thursday's referendum are trickling in, which could allow President Pierre Nkurunziza stay in office for 17 more years. Well, they are expected to show a big majority in favor of the change. There are reports from polling stations say some people were being forced to vote to avoid being beaten or arrested. Foreign journalists were mostly denied access to the country during the vote, and opposition voices have been largely silenced. Burundi has been ravaged by political violence since 2015, when Mr. Nkurunziza ran for a third term. And the UN agency is warning of an emerging crisis along the Niger border after reports of Algeria dumping migrants in the Sahara Desert. The International Organization for Migration, IOM, says that it has dealt with almost 10,000 migrants abandoned in the desert since September. Some have been led by traffickers, but others were deported by Algerian authorities, left in the desert and told to walk to the nearest border town. In the sun, the scorching sun, a number of people have died, including pregnant women and children. One migrant from Mali alleged that they were treated badly, forced to walk dozens of kilometers to reach the border town of Asamaka, and their belongings were confiscated.